Hello, I'm Dr. Deuk, board-certified neurosurgeon. I am here today to talk to you a little bit about the Deuk Spine Institute and our mission with respect to educating people on spine conditions and the best treatments available in the world. I know many of you have heard all types of sales pitches and everyone has some new snake oil or something to sell you. We're not here to sell you anything. Our goal is to provide meaningful, truthful, insightful answers into the latest knowledge and understanding about back pain, neck pain, and how to effectively treat it properly in the least invasive, most successful way possible. So there are over 100 million people in the United States suffering with chronic back and neck pain. And the truth is that the cause of the pain is pretty limited to a few conditions. And those conditions are typically related to the joints and the spine. Those conditions include herniated discs and facet joint pain. Herniated discs and facet joint pain are the two most common causes of chronic back and neck pain, and they account for about 98% of all chronic back or neck pain. The real trick is figuring out which one of them is the cause of each person's pain. And in some people, up to 25%, they have both disc pain and facet joint pain, so they need both treated. A lot of people think pinched nerves are the cause of back or neck pain, but they're not. That's one of the most important myths I really want to disperse with. Pinched nerves never cause neck or back pain. Pinched nerves cause leg pain because the nerves go from your back all the way down your leg. And the purpose of a nerve is like a cable bringing information from the feet, the ankle, the leg, and the thigh up to your brain. So the nerve connects to the spinal cord in the lower back. But before it does that, its job is to carry sensory information about painful things or vibration or temperature changes, and also to carry information from the brain to the muscles to allow you to move your body and let your legs move during walking or running or even playing soccer. So these nerves, when they get pinched, they send missed signals up to the brain about things that are going on. That's why people with sciatica or a pinched nerve in their back have leg pain. Their leg really isn't being damaged in any way. It just feels like it is. And that's because the nerve is being pinched or irritated in the lower back. So with this introduction, I'm going to get into my education, and then we can talk about more interesting things related to chronic back and neck pain. All right, I am board certified and I'm trained in neurosurgery. I went to the University of Southern California in Los Angeles, USC, for medical school. I did 4 years of med school there. I graduated valedictorian in my medical school class. I had the highest grades in my class. I also went to UC San Diego, University of California, San Diego, for undergraduate. And after UCSD to USC for med school, and after USC, I went to the University of Florida in Gainesville for neurosurgery training. I chose the University of Florida in Gainesville because it was the #1 neurosurgical training program in the country. This was back in 1996-97. And after graduating from my neurosurgery program, I was quite proficient in treating patients who had brain injuries as well as spine injuries and nerve injuries. My focus then over the years evolved into spine care, and that's really what I do now. I pretty much treat patients with spine injuries, whether it's chronic neck pain or back pain from a herniated disc, spinal stenosis, pinched nerves. That's what we treat here at Deuk Spine Institute. Somebody asked me on Reddit, where do I have hospital privileges and how long have I been in practice? I've been in practice 26 years if you include my medical school training. I've been in practice in Brevard County here in the Space Coast of Florida for the last 16 years. And as far as which hospitals do I have privileges at, well, you can pretty much see based on my identification tags, I have privileges at Wusthof Hospital, which is now called Stewart. I have privileges at Parrish Medical Center and privileges at Vieira Hospital. So I have privileges at 3 hospitals and 1 surgery center. Surgery center being Surgery Center Vieira. We were asked at the Surgery Center Vieira, do you have a majority ownership in the surgery center? The answer is no. I have a minority ownership. Is the surgery center JCO accredited? No, most surgery centers are not JCO accredited. Most surgery centers are AAAHC accredited, and we are AAAHC accredited. As a matter of fact, we've been AAAHC accredited now for 7 years. since the very inception of our surgery center, which is spine focused, and our HHC accreditation has been at the highest standard with virtually perfect scores every 3 years when we're re-accredited. I was asked to talk about my practice. I'm Dr. Deuk Majin. I'm one of the team members here at Deuk Spine Institute. We have other doctors here as well, but my focus is surgery of the spine for degenerative conditions, which include degenerative disc disease, herniated disc, bulging disc, spinal stenosis, pinched nerves, anything to do with degenerative conditions of the spine. I have partners like Dr. Bharat Patel, who is 5 board certifications in physiatry, interventional pain management, sports medicine, pain medicine, and electrodiagnostic medicine. Dr. Patel's specialty is interventional pain management. We also have Dr. Philip Demola, whose specialty is medication management. He is a physiatrist as well. And we have primary care doctors. We have a very active fellowship program. We train fellows from all over the world. Right now we have a fellow in training in interventional pain management. I've been asked if my practice is limited to disc herniation repair. The answer is no. My practice is not limited to disc herniation repair. However, that's what I spend the vast majority of my time doing, is treating patients with herniated discs that have pain in their back, neck, or thoracic spine, and the pain can radiate into their arm or legs depending on where the herniation is. So yes, I spend most of my time dealing with herniated disc because that's the most common problem people have, but I also treat all types of complex injuries to the spine. If you go to our YouTube channel, you can actually see that I do very complex spine surgeries, including lumbar fusions that are multi-level, and we do all these surgeries outpatient. So patients go home usually within 2 to 3 hours of their surgery when they're having fusion surgery. I've done over 1,000 anterior cervical discectomy and fusion surgeries. I've done about 600 posterior cervical laminectomy infusions, and I've done over 1,000 lumbar decompression reconstruction instrument infusions. We call them T-lifts, but there's also Smith-Peterson osteotomies and pedicle screws, rods, interbody cages, interbody fusion, and posterior fusion. All right, I've also done microdiscectomies, artificial discs in the neck and back, laminectomies, foraminotomies, you name it. I do it as long as it works and it's effective and safe for patients. There are a lot of spine surgeries that are done out there, not by us at Deuk Spine, but they don't work. We don't perform those types of surgeries. People ask me all the time about certain devices or implants or techniques in the spine that we don't perform. The reason we don't perform them is not because we cannot perform them. We can. We don't feel ethically it's right to perform surgery on patients that won't benefit them to the max or that exposes them to unnecessary risk. For example, the X-lift procedure. I don't perform the X-lift procedure. I have performed it. I'm familiar with the X-lift procedure, but the risks associated with X-lift and A-lift procedure, these are anterior and anterolateral approaches to the lumbar spine. These surgeries are very risky of damaging blood vessels and nerves in the lower back. I don't recommend them for patients because we perform much safer surgeries like the Deuk laser disc repair. Deuk laser disc repair is the most advanced endoscopic spine surgery available in the world for a herniated or bulging disc that causes neck, thoracic, or back pain with or without arm and leg symptoms from a pinched nerve. And the success rate of the Deuk laser disc repair currently is at 98% average elimination of neck pain, back pain, and the arm or leg symptoms. So imagine if you had chronic back pain for 20 years, you were told there's no cure to it. You're the perfect patient for the Deuk laser disc repair because we can actually eliminate your pain 98% of it. I say that with confidence because if you go to YouTube and look up Deuk Spine Institute, you will see literally 1,000 of our patients with talking about how their pain has been cured in their neck or back. We put all of this out there for the public to see. We're hiding behind nothing, full transparency. We also broadcast all of our surgeries live every week. As a matter of fact, we'll be broadcasting surgeries tomorrow. And in particular, we're going to be doing the Deuk laser disc repair surgeries tomorrow. Tune in to the Deuk Spine Institute's website. You can watch live surgery. You can even ask questions during the surgery, and I'll answer those questions for you. We do that every week. My other questions from my practice are, am I comfortable with artificial discs? Absolutely. Putting an artificial disc in is very easy, very straightforward. I'm not comfortable recommending artificial discs to patients because artificial discs don't work and they're unnecessary. Frequently they fall out, they get displaced, people continue to have pain from the artificial disc surgery. They have pain that was there before the surgery that doesn't go away. So I have a real hard time recommending a treatment for someone when that treatment is not optimal, when that treatment is suboptimal and has inferior results with respect to pain relief and creates all kinds of complications for the patient. So yes, I can put an artificial disc in, no problem, it's easy. However, I don't recommend artificial discs, just like I don't recommend laminectomies and microdiscectomies much anymore either. There is a very small number of people who are currently getting fusions or artificial disc surgery that actually really need artificial discs or fusions. Probably about 95% of the patients currently in the United States recommended for artificial discs or fusions don't need them. Why? Because we now have minimally invasive Deuk laser disc repair endoscopic surgery that basically eliminates the need for metal to be put in the body, eliminates the need of implants. Why haven't you heard about it? Because the companies that sell the implants, whether they're artificial discs or they're fusion cages or metal, those companies are promoting fusions and artificial discs so strongly in the United States and other countries that patients aren't even hearing about alternative treatments that are better, like endoscopic spine surgery. So that's what we're here for. We're here to educate the public on what's really available. We are not controlled by these large companies that have a financial interest and bias towards you getting metal put in your body. So you're going to hear the truth from us at Deuk Spine Institute. We do weekly broadcasts. Check out our YouTube channel. We have tons of content for you to look at. Just in closing, the last few questions for me are asking about whether I'm comfortable treating patients with spine conditions that have been going on for a long time. The answer is yes. Most of our patients have been in pain, suffering for years. Many of our patients have already had spine treatments elsewhere that have failed. We're still prepared to take care of those patients. We're not here to discriminate against people in any way. We want to help everyone that's suffering with chronic back or neck pain get better. Feel free to ask questions on our Reddit channel. I'll do my best to answer them for you. Thanks. Nice to meet you.